Hello students, welcome back to my digital classroom. In today's class, we'll discuss about the chapter Care of the Sick at Home of your Health and Physical Education book. Now, Care of the Sick at Home. First of all, let us know what is meant by home nursing. Or what do you mean by home nursing? Now, the process of taking care of sick at home is known as home nursing, which includes many activities. The person who takes care of a sick person is termed as attendant. And in case of home nursing, there are various activities on the part of the attendant. For example, preparation of the room for the sick person, preparation of the bed for the sick person, preparation and serving food, giving medicine in proper time to the patient, and keeping a record of the patient's condition. For example, his temperature, blood pressure, etc., for the use of the attending physician. Now, what is the role of home nursing? Proper care of sick person at home with adequate and careful home nursing, it plays an important role in providing relief to the patient, and that makes him free from the diseases and suffering. Now, there are various kinds of diseases in which medication is not only sufficient, it requires proper kind of nursing for the quick recovery. Now, if we know or if we learn proper nursing procedure and acquiring nursing skill, we can take great care of a sick person at home, and we can provide proper home nursing to the sick in the family, and in many cases we can help in early recovery of not only the patient but can also protect other members of the family from getting sick. There are various kinds of diseases which are highly communicable, which can spread from one person to another within a very short period of time if we don't take proper kind of precaution. For example, if any member of our family suffers from the disease called tuberculosis or TB, in that case we can save other members of the family from same kind of infection by taking necessary precautions. However, this can be possible only when we are aware of the various principles of home nursing. So, in that way you can say that this is an advantage of learning home nursing procedure. There are several other advantages also. Now, during the states of emergency or say war, now with a view of provide accommodation in hospital for seriously injured person, that time hospital remains full with injured person, or say their provisions are kept for the injured person. Those sick and wounded who do not require constant attention in the hospital may have to be nursed at home. Therefore, it is essential that as many men or women as possible should have an elementary knowledge of the needs of the sick persons and know how to make them as comfortable as possible. Especially in our country, most of the people reside in village areas where hospitals are not so well developed, or in many places hospitals are not available within easy reach of every individual. Now in that case, or say in the event of war, now many facilities like a blanket, bed linen, medicines and variety of foods etc. may be in short supply. Doctors and nurses would also be extremely busy. In that case, knowledge of home nursing provides a great relief for not only for the family but also for the society. People who have some knowledge and skills about the elements of home nursing prove very useful for the country. Now next we'll see that if you are required to take care of a patient at your home, what precautionary measures would you like to take about your personal hygiene? As I told you earlier, that the person who takes care of a sick person at home or takes care of sick person is termed as attendant. Now, an attendant should take various precautionary measures before he or she takes care of a sick person. The attendant should be very careful about his own personal health. He or she should wear clean clothes. Generally, in that case, apron is very much essential. It is most essential to take precautions against spreading the patient's germ from the sick room, especially if the person is suffering with any kind of communicable disease. The precautionary measures should be taken so that the disease-causing germs is not spreading from the sick room to other room in the house. When caring for the patient, the attendant should protect his or her clothes by wearing a covering garments or an apron. And these garments should be kept inside the sick room only, just near the entrance, and be put on as soon as the attendant enters the sick room. Before leaving the room, the attendant should keep the apron on proper place. That is, after finishing work, the protective garment should be removed and the face and hands should be washed thoroughly with antiseptic lotion or soap. Particular attention should be given to area between the fingers and around the nails, because there are several gaps are there in which the germs may enter or germs may hiding over there. Hands should be washed up to the germs and rub together a number of times, and thereafter these should be washed in running water. Another step every attendant should take, that is, attendant should always remember to protect himself from the patient and the patient from him. In the sick room and until the hands are washed, the hands should be kept away from the mouth and face. Precautions should also be taken to keep away from the direct spray from the patient's nose and mouth. And for that case, wearing a face mask is very essential. We should not come in contact with the patient, or the attendant should not come in contact with the patient directly until and unless it is necessary. Similarly, due attention should be given to protecting the patient from the germs which the attendant might be carrying. In case the attendant is suffering from cold, he should cover his mouth while taking care for the patient. So these are the precautionary measures should be taken by the attendant before taking care of a sick person or before going for home nursing. Now next we'll see what are the psychological needs of the patient. Generally, whenever any person falls sick or suffering from any kind of disease, the emotional condition of the patient turns into a very bad shape. He gets irritated with minor things and becomes pessimistic about life. In many times, he becomes extremely disappointed and nervous. The patient may become too depressed. In such a condition of the patient, the patient may further retard the process of recovery. If he is depressed and nervous, then in that case, recovering from any kind of disease takes longer period of time. Therefore, it is very important and essential that we should be very careful in our dealing with sick persons. We should understand his feelings, and in that way his feelings should in no way be hurt. He must be kept cheerful and free from any kind of worries. Now, while taking care of sick person at home, it is better for the attending person to be good natured, cheerful, polite and sympathetic in his talks and behavior with the patient. Discussions on or about unpleasant things and events should be avoided in every cases. The patient should not be told about the severity of the disease, which makes the patient more nervous. but be given consolation and assurance that soon he can recover from the particular disease. The patient must be provided adequate opportunities of rest, sleep, and recreation. Visitors for a while are good for the patient, because in that way the patient's mind can be diverted. But involving that patient in long discussions and conversation with others should be avoided, because at that time during sickness the patient's body becomes extremely weak. Long discussion or long conversation may harm the patient. Therefore, visitors must be avoided, or the visitors must be advised not to discuss unpleasant things with the patient. Now, what type of room or place is suitable for the sick at home? The most important point for home nursing is to find a proper place for the sick at home. Now, for home nursing, the patient should be kept at a place which is convenient and comfortable for the sick person or for the patient. Now, if it is a communicable disease, every effort should be taken to keep him at a proper isolated place. The place should be well ventilated but without direct draught of air on the patient. The room should get proper sunlight, or it should be proper lighted for reading or other activities. But care should be taken so that the light should never shine in the eyes of the patient. The patient should be kept as far as possible at a place from where it may be easier to provide necessary assistance and answer the calls as and when required. The place where any sick person, the place of the sick person should be clean, and it should not contain any kind of article which cannot clean easily. And also every care should be taken to prevent the sick room from fire accidents. Now, in many homes, proper isolated room or isolated places are not possible. In such cases, to have a separate room for the sick, the room can be divided into two portions by arranging partitions with the help of curtains. And as far as possible, necessary articles for the use of the patient like hot water bottles, ice cap, vessel for disposal of vomits, then towel to clean hands and face, thermometer, rubber sheet, bedpan and urine pot should be procured or improvised for the use of the patient and arranged. Medicines for the patient should be arranged and kept in such a way that they may be easily available and are also beyond the reach of children. Now next we'll discuss how to take care of sick at home. Since the patient cannot take bath properly, or sometimes the patient is unable to move to take bath, in that case the patient should be given regular sponging of the whole body with soap and warm water, and this should be followed by gently rubbing the back with a spirit and finally powdering it. Proper care should be taken during the time of sponging. In that time, the room temperature should not be too high or too low, and there is no direct draught of air on the patient. The patient's teeth, mouth, hair and back need special attention and proper care. His mouth, teeth and gums and tongue should be cleaned daily with saline water, that is, water mixed with a pinch of salt or other mild antiseptic lotions like Listerine mouthwash or any other such kind of, to get rid of food particles, bad taste and odors. Such care stimulates the appetite and prevents tooth decay, gum disease and infection of the parotid glands. If the lips are dry, a little cold cream or Vaseline or ghee should be applied. A piece of fruit like orange or sweet lime given after food, which cleanses the mouth very well. Next important thing is that to give proper food and diet. Now, giving proper food at proper timings is also very important. As we know that food gives adequate nourishment to the body and which helps to repair and build up new tissues to maintain body resistance and to protect from any kind of disease. The food to the patient therefore should be given as per as instructions of the doctor. Before feeding, it should be ensured that the food is well prepared, it should be tasty and it should be served in a clean and attractive way. The attendant, should always be pleasant to the patient and should persuade him to eat the right quantity at the right time. Small quantities of food should be given to the patient at short intervals when the patient is not in a position to eat sufficient quantity at any one time. Regarding the clothing of the patient's clothing should always be light, clean and loose so that the clothing can be changed very easily. The bedding should be well layered and the sheets clean and changed regularly. The bed on which the patient lies be raised from the ground. The patient's hair should be welled and combed once in the morning and again in the evening. And while combing the hair of the patient, one should be very gentle and should start doing the ends first and then gradually go to the roots. In case the patient is ill for a long period of time, then a hair wash is necessary about once a week. Now, what happens during prolonged illness? A patient spends most of his time in bed, in a lying position. Therefore, the patient's whole weight of the body is borne by the back, buttock and the other pressure point, which tends to break the skin in these areas. Such kind of skin breaks is termed as bad sore. Now, to prevent a bad sore, the position of the patient should be changed frequently, and the bed should be kept quite clean and smooth. There should be no creases, dirt or moisture on the bed. At the time of birth, the back and the pressure point should be rubbed with firm, even strokes washed with soap and water and then dried. After drying, spirit should be applied to the whole area and dusted with talcum powder, which prevents friction of the bed sheet with the skin. In chronic and serious cases, back care needs to be carried out after every 4 hours during the day. Regarding the providing medicine to the sick person, medicine should be given in the exact manner and doses as recommended by the doctor. If the patient is bedridden and helpless, before giving medicines, his mouth should be washed properly before giving the medicine. His mouth should be washed properly and after having the medicine. He may be asked to do gargling. The bottle of the medicine should be taken before a dose is taken out. The bottle of the medicine should be taken before a dose is taken out. The dose should be recorded. Now, if the patient is not in a position to swallow the tablets, they should be crushed into powder. Proper arrangement should also be made for the disposal of waste and vomits of the patient. If the patient can go to the bathroom, it should be ensured that he cleans his hand and feet properly after returning from toilet. In case he is not in a position to go to the bathroom or move from his bed, he should be supplied a kidney tray and bedpan. And after use, the waste should be either disposed into the toilet or buried at least 9 to 12 inch deep in the ground. The kidney tray and bedpan should be properly washed, and thereafter the attendant should clean his hands properly with soap. And for the disposal of the vomits, a covered vessel with antiseptic solution can be kept in the room, which should also be cleaned daily. Regarding sputum and discharges may also be either be buried or burnt. The patient's attendant at home should also have a record of the condition of the patient. It should indicate information about the temperature of the patient, then the general condition, pulse rate of the patient, respiration rate, then kind of food taken and quantity of food taken, about the medication, and if any complaints regarding the patient's condition. Now, such details record is very useful and helpful for the doctor to treat the patient. Now, before taking all these record, one should have proper knowledge or proper idea about all these things. For example, while taking temperature of the patient. Now, body temperature is measured by a clinical thermometer. And our body temperature, normal body temperature, ranges between 36 degrees Celsius and 37 degrees Celsius, or 96.4 Fahrenheit to 98.6 Fahrenheit. Temperature of the patient should be recorded by putting the thermometer bulb below the tongue for 1 minute. This is supposed to be the correct temperature. Taking temperature by putting thermometer's bulb below the tongue gives almost accurate temperature. But in certain cases, and in case of children, it is not possible to take mouth temperature. Okay. The thermometer should be inserted in the armpit. In that case, the thermometer bulb should be inserted in the armpit or groin fold. Next important thing is that to count pulse, taking recording of pulse rate of the patient. Now, what is pulse rate? The pulse is the throbbing caused in the blood vessel by the contraction of the heart muscles as they force blood through the blood vessel. The rate and rhythm of pulse gives an idea of the functioning of the heart and blood circulation. The pulse can be counted on any artery by placing one's finger. Usually the pulse is counted for 1 minute on the thumb side of the patient's wrist above the palm by placing 2 or 3 fingers. Now, pulse rate varies according to the age. At birth, the pulse rate ranges between 136 to 140 beats per minute. At 3 years of age, it reduces to 100 to 120 beats per minute. In 6 years, it reduces further to 91 to 100 beats per minute. 7 to 14 years, it becomes 85 to 90 beats per minute, and 15 years and above, the pulse rate is 70 to 80 beats per minute. Next, how to count respiration rate. The number of breaths taken in and out in a minute is called respiration rate, which is an index of the patient's condition and can be counted by observing the rise and fall of the chest for a minute. The normal rate of respiration is 16 per minute. And last important thing here is that personal health. Okay. So that's all from this chapter. How to take care of sick at home, what is home nursing, then what are the advantages of it, how to take care of it, how to take proper care of sick at home, what are the precautionary measures an attendant should take before taking care of sick person, and all. So I hope it is clear to you. In next chapter, next class, I'll come with another new chapter. Till then, take care of yourself and learn properly. Thank you.